48 persons, including law enforcement officers and care providers from across the country, graduated today from a 6-month drug and violence prevention, treatment, and rehabilitation program. They all received their certifications from the University of the West Indies that will allow them to provide services to individuals with problems directly related to drug abuse and violence at rehabilitation centers countrywide. Executive Director of the National Drug Abuse Control Council, Esner Veos.
In 2011, we were assured that the program was going to be implemented here in Belize. Fast track up to 2015, the National Drug Abuse Control Council gathered approximately 70 participants to be able, frontline social workers, to be able to provide them with training, capacity building in treatment, rehabilitation, and for the reduction of drug consumption and violence in the country of Belize. Of that amount, we have approximately 48 trainees that are today being certified by the University of the West Indies in both the prevention track and the treatment track. With the certification, the new frontline officers would be able to go and develop programs that will be able to address the reduction of the demand of drugs. But more important is that with the knowledge that they have gained, they will be able to also implement the design of the programs into their own work.
Corozal resident Liliana Itza Chablé will be working out of Orange Walk, providing treatment for those persons that would seek help from clinics and rehabilitation centers. She says that the journey was not easy.
It was 6 to 7 months of hard work, studying. We would usually have Thursdays coming here at Belize City, which was, I had to wake up early from Corozal and travel all the way here to Belize City for the training. And then after that we had work, assignment, plus test, and so it was a lot of hard work, but then all that hard work has paid off, and it has been a lot of knowledge, skills that I have learned and attained, and I plan to use all those knowledge to help those people in need, right? And as part of my job, I have been doing that, but then now with this training, I feel more prepared and more able to help all those that need that help.
Several officers from the community policing unit of the police department successfully completed the program as it pertains to prevention. Sergeant Brent Hamilton says that there are some immediate programs that can be implemented to address the issue of drug abusers.
We can promote universal signs where you can say no to drugs. The sign must be friendly, it must be conducive to that anybody from any different ethnic group can understand. We can go into the school and do presentation on drugs and say no to drugs. We can do workshops to different communities as to how they can prevent their children not to go into that angle or in that area of drugs. As community-oriented police officers, we go into schools, we go into community functions. Based on what we see and what is the problem that we see, based on mediation, the results of mediation, with the training that I have now, it will be able me to go in and to provide the better education and the better preventive measures that we can use in the community so that we can have a safer and better Belize.
The PROSER program was introduced to Belize in May 2011 under the Secretariat of Multidimensional Security of the Organization of American States to develop and strengthen member states' institutions for individuals with problems related to drug abuse and violence. Dwayne Moody for News 5.